Broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone. We're so happy to have you here today with us. My name is Mindy Bennett, and I'm the Deputy Chief of Partnerships with Child Care Aware of America. I'm excited to be here with you today, excited that you're able to take time to learn about what other states are doing around the work in COVID-19 and supporting families and early childhood educators. I want to turn the floor over to my colleague, Kiami Harris, who's going to tell us more about our presenters.
Good afternoon. Before we get started, I wanted to just thank all of you for joining us and to do a couple of housekeeping pieces. One, we are absolutely going to be taking questions at the end of this session, so please feel free throughout the session as you have questions to put them in the question and answer box. We also are recording this session and will share out the slides with you in an email and also have them on our website under COVID, right on the first page of the Child Care Aware of America's site. So I want to just say today that we have two dynamic states, Illinois and Louisiana, and we have great presenters who are going to share amazing information with you about the work that they're doing in their state. I wanted to, before we get started, give an opportunity, I see Ami is here, to also welcome you all. Ami.
Thanks, Kiami. Can you all hear me okay?
Yes.
Awesome. Thanks everyone so much for joining us. We're really grateful to have continued interest in the work that states are doing to address this crisis. And we're grateful to be able to get some time from these folks in Illinois and Louisiana to speak to some of the work that we're doing. As the series has continued, our goal has always been to share out what others are doing so that it's helpful to you, both as we think about this current continued crisis response, and then naturally as our brains start to shift towards rebuilding in the future, and what opportunities we may have to create a stronger and more equitable childcare system, how we can begin to think about that moving forward. So thanks, Kiami, and I'll turn it back over to you now.
Thanks, Ami. So our first presenter is Dan Harris, and Dan is the Executive Director of the Illinois Network of Child Care Resource and Referral Agencies and board member at Child Care Aware of America. Dan has over 20 years of experience administering social service programs in Illinois, New Mexico, and Wisconsin. His programmatic responsibilities have included leadership roles in a range of programs serving children, families, and communities, including child care subsidy, state-funded pre-K, home visiting, and youth development. As Executive Director of INCRA, he leads an organization of 70 staff responsible for an array of services supporting high-quality early care and education throughout Illinois. He holds a master's degree in public policy from the University of Chicago. Next, we're going to hear from Nasha Patel, who serves as the Deputy Assistant Superintendent of Early Childhood Strategy at the Louisiana Department of Education. In her current role, she leads the strategy to increase access to and quality of care and education for children in Louisiana through the state's unified Birth to Five system. She's been working in the Office of Early Childhood since 2014. She has a bachelor's from Barnard College in Classics with a concentration in education and teaching certification, and an MED in Education Policy and Management from Harvard Graduate School of Education. We also have Karen Powell, who is the Regional Director of Partnerships in Child Care Division of Volunteers of America, Greater Baton Rouge. That division serves as the Child Care Resource and Referral Agency for 24 parishes in Louisiana. Karen has 23 years of experience in education, teaching in higher education, as well as developing trainings in new curricular policy and infrastructure and assessments and measurements. She also has 16 years of experience with research into best practices, program development, administration, partnership development, and staff supervision and leadership. Karen has brought together and led diverse groups and partnerships on new programs, facilitating work both within and outside of nonprofit agencies, and has launched and directed multiple national early childhood development and school readiness initiatives in the region and the state. At Volunteers of America, Karen also helps support effective implementation of statewide early care and education reforms. And finally, you'll hear from Jen Roberts, who is the president of Agenda for Children. In this role, she currently serves as executive director of the New Orleans Early Education Network, an entity managed by Agenda for Children and created by local early childhood practitioners to respond to the state's Act 3 mandate that each parish in Louisiana manage state requirements to increase access to early childhood education, improve the quality of early learning experiences for young children, and connect organizations who work with and on behalf of young children. Prior to her roles, Jen spent nearly a decade as Senior Vice President of Grant Making at a large private foundation in Southeast Louisiana. Her career has also included work in an education policy startup, higher education, workforce development, K-12 education classrooms and administration, and in direct youth development programming. In 2019, she was named an Aspen Institute Economic Opportunities Fellow and founded the New Orleans Early Education Research Alliance with faculty from Tulane University Education Research Alliance. She earned a bachelor's degree in urban studies and a master's degree in education policy and management from Harvard University. Now I'm going to turn it over to Dan.
Thanks, Cami. So if we could just advance to the first slide. There we go. Thanks. So I just wanted to set the context a little bit to, and I included this slide partly to brag on my peeps, but also partly to say that Illinois has made significant investments over the years in the creation of a robust professional development system, and INCRA is a big part of that. We have a training registry with over 110,000 members. We administer early care and education scholarship programs for the state of Illinois and the city of Chicago, separate programs. We have a credentialing system. We administer a wage supplement program. We do the front-end processing for the state's QRIS applications. A lot of training development and perhaps more ethereal, but in some ways, but significant, is that INCRA often plays the role as a convener and communicator. So we bring folks together across different sectors. We're seen as an honest broker, if you will, both of information and relationships in the state of Illinois. And this context, I think, is important because it was on this sort of foundation in a lot of ways that this foundation that allowed us to accomplish much of what we've been able to do over the last, and I just looked at calendar, 5 weeks. It seems like it's been a lot longer than 5 weeks, but if we can move on to the next slide, please. And I did this, I mixed in some internal things that INCRA has done to sort of its day-to-day operations, but focusing mostly on what's happened in the state of Illinois. And kind of rated as across chronologically from a time frame, partly because some of the time frames seem really remarkable to me. But anyway, so back on Friday, March 13th, Governor J.B. Pritzker announced that schools were going to be closed. And with the closure of schools, that meant a lot of things for INCRA, both internally in terms of our staff and what were their kids going to do during the day, as well as kind of everybody else. So one of the things that we did initially was on the 13th was we went through and did an inventory of all the trainings that we had for the next 6 weeks or so, and if they could be done on some sort of virtual platform, we notified folks that we were going to do that. If they could not, then we canceled them. We also revised our personnel policies internally. We expanded our flex times opportunities, letting people work anywhere from any time between 6 a.m. and 9 p.m. Again, noting that we have a lot of parents that work for us, and to allow them flexibility in working out there, taking care of their kids that weren't going to be in school. We also loosened up some of our sick leave requirements so that people could take advantage of that if they needed to. On the following Monday, we launched a portal for providers to report openings. So we had heard that a number of childcare programs with schools were also starting to close. The governor hadn't taken any formal action yet, but we had heard that a number of childcare programs were starting to close. So my team worked over the weekend to create a portal that providers could log into and say, hey, we're still providing care, we're still available, so that we can make that information eventually make that information available to families looking for care, but initially just to sort of give the governor's office and other policymakers an opportunity to find out, hey, what's going on out there. Also on that Monday, the Illinois Department of Human Services, or IDHS, which funds about 2/3 of the operations at INCRA, and is also administers the child care subsidy program in Illinois, issued and probably has, I think, a couple of thousand contracts throughout the state for a wide range of social services, issued guidance saying that we, as if you are a contractor with the state, we're not going to penalize you financially for not meeting any of your performance targets. If you slow down operations or even have to stop some of what you're doing, we're not going to financially penalize you. And that was an important milestone for us, because it allowed us to make some decisions about what we were going to do, and helped guide provide important guidance to us and other contractors around the state that do work on behalf of the state. Also on that Monday, the state issued an attendance exemption for the child care subsidy program. So the way it works in Illinois is that specifically, and this does make Illinois unique, but if you're serving children on the child care subsidy program, you get, depending upon the needs of the family, how often they're going to be in care, you get an allowance of or leeway, if you will, in terms of what you get paid for that family, as long as they're there for 80% of the approved hours. What the state began developing on March 16th was an exemption for that, behind kind of one of the principles that we knew that it was clear, I think, pretty early on that there was the damper that was that the pandemic and that the subsequent stay-at-home orders were going to have. And so one of the principles was to keep as much money flowing into the community as possible. And so the state wanted to do that through the child care subsidy program, so developed this attendance exemption policy. I'll talk more about that in a minute. The other decision that was made early on that was extraordinarily helpful was to decide on a single point of information. And that was through the Governor's Office of Early Childhood Development, their COVID-19 website, and that was launched on that Monday, the 16th. And it's been somebody in that office, someone in that office, it's been their kind of full-time, just about full-time job to keep that site current, so that people can go there and know that they're getting the most up-to-date information. I included that link because I'm going to only touch on some of the policies that the state implemented over the last 5 weeks, but it's a pretty comprehensive. I mean, that is a comprehensive list of everything that we've done and all the supports that are available, both for families and for providers. 5 days go by. On Friday, March 20th, the governor officially closed all child care programs with a directive to the Department of Human Services that there's be emergency care opened up by Monday of next week, which we missed that by a day. But so again, over the weekend, there was a lot of work by a number of folks, including number of members of my team. So we developed an emergency child care portal for providers, so that a child care provider seeking to provide emergency care, because what happened on Friday was in effect, their child care licenses were suspended. So if they wanted to provide care, they needed to go through a separate process. So there was guidance developed on what emergency child care was going to look like, that you could have, for example, no more than 10 kids in a classroom, and no more than 5 classrooms in a facility, and some other CDC recommended protocols for those providers. There was also an acknowledgement on the part of the state that the entity that does child care licensing in Illinois, which is the Child Welfare Agency, probably wasn't going to be able to process all the emergency licenses, a new license, a separate license, in the time frame that we were seeking. So what providers were told was to go to this emergency child care portal, put in your information, indicate that you're applying for an emergency license, and then you can open your doors. So we got that portal up by Monday. We also developed a helpline, got a toll-free number for families to use so they could call and get information. We trained the R&R staff on the helpline because the calls were going to be distributed to child care resource and referral agencies around the state to answer. We also developed this a searchable database so that once a provider put their information into the emergency child care portal, that data could be searched by the R&Rs that were referring folks to care through the helpline. And originally that database was only open to the CCR&R staff. I think within a few days we opened it up so that anybody could look at it. And we also held a webinar, a business practices webinar for emergency child care providers and all child care providers on here's what's going on, here are the supports that are available, et cetera. And that maxed out at 3,000 attendees. We've subsequently been holding probably 2 or 3 webinars a week, either for our child care resource and referral staff, for all child care providers, on this, that, and the other thing, because there have been a number of changes to the subsidy program. Flexibility has been kind of one of the key words as we've moved through this, providing supports in response to the emergency. So again, on Tuesday, the 24th, child care providers began providing care. I think there are actually probably some open the day before, but the other thing that happened on Friday the 27th, and this actually sometime earlier in the month, I didn't include this in the time frame, but the governor, not in his role as governor, but in his role as wealthy philanthropist, started a Illinois COVID-19 response fund. And that fund made up of private philanthropic dollars, not just from Governor Pritzker, but from a number of other philanthropic organizations, I think has somewhere between $20 and $25 million in it. And I got a call late Friday, the 27th, inviting INCRA to apply for some of those funds. I got the application that evening and found out that the application was due on Sunday, the 29th. So we had about 48 hours to pull together an application for these funds, which we did. I'll talk more about that in a little bit. But again, on the following Monday, the state had been working on stipends to emergency child care providers to give an incentive to those for people to enter into that work to provide emergency care. And within a few days, and INCRA was playing a role in that in terms of the application for the stipend flowed through initially to INCRA and then was reviewed by the regional child care resource and referral agencies. And then we are actually cutting the checks for anywhere, depending upon the type of provider and the number of kids that you're serving. The stipends are anywhere between 750, a one-time stipend of anywhere between $750 and $750 and $3,000. So we've been processing those. Actually, the first round of stipends went out. I think there was about 1,200 or so that went out yesterday. On Friday, a week after I received the notice of the application, we were awarded a $250,000 grant from the Illinois COVID-19 Response Fund. And what we had applied to do was to distribute $500 preloaded debit cards to families furthest from opportunity. And so I had convened the 16 regional child care resource and referral agency directors to talk them through how to go about doing this and what criteria to use for distributing these cards. We placed an emphasis on immigrant families without documentation, acknowledging that those families weren't going to be getting much of the federal relief, like they're not going to get a $1,200 or $2,400 check, and a number of other sorts that supports in place for a lot of families weren't going to be available to those folks. So we tried to emphasize that, but we largely left it up to the CCRNRs and regionally to decide how they were going to distribute those much needed supports. So we ate the cost of the fees for the cards as well as we didn't take any administrative dollars. So we were able to distribute 500 cards through the R&Rs. We used a kind of formula to decide which R&R got how many, but that's been, we were very grateful to receive that and very grateful to be able to use our infrastructure to provide some of those supports. Another support that we partnered with Illinois Action for Children, which is the CCRNR for Cook County, which includes Chicago. They kind of led the charge on an effort to get some philanthropic dollars to bring some tax consulting firms to the table to help childcare providers submit applications for the Small Business Administration supports that were available through the CARES Act. And so we worked through that weekend to help get something up and running for that. That support began, I don't think I included this on the, that support began on the following Monday. And a multi-step process, but INCRA served mainly as a source of communication. We've done a number of blast emails out to childcare providers, alerting them to what supports are available, where to access them. We also maintain a few different websites as well as a couple of different Facebook pages that we've used to provide information to the folks doing the work. On Sunday the 5th, the governor focused solely on childcare. He's been doing daily COVID-19 press briefings since this began, and on Sunday the 5th, it focused solely on childcare. At that point, he also announced that all essential workers priority. Actually, there's been the executive order that he issued closing. He issued the stay-at-home executive order. Also included a list of folks that counted as essential workers, and then there was some further definition around essential workers that were going to be eligible for basically automatic admission into the child care subsidy program. So they were automatically enrolled. There was a simple application they had to complete with a co-payment of $1, and then they could take advantage of they wouldn't have to pay for childcare. on the 7th, we're going back to the prepaid debit card. We were able to issue those to the 16 R&Rs within a week or so. Most of those were, I think all of those were distributed within a week. We're doing the follow-up right now and gathering information on that. It's wonderful, wonderful stories, like very touching stories of families that didn't know what they were going to do until they got this this card. So we were really happy. Again, a lot of this, I've hit some of the highlights. The state has done a lot in terms of child care policy, which is available on the link that I provided. Earlier. There's I'd want to go, if we go to the last slide. I wanted to say that there were some principles that we sort of landed on as a state early on, and I've mentioned a couple of them. One was like one of the principles was out of an acknowledgement the damaging effects that this was going to have on the state's economy is to do whatever we could to keep the money flowing, and to have that sort of principle, for example, allowed us to do things with the wage supplement program that we administer for folks working in early care and education. And we streamlined the renewal process for that, again, with an idea of keeping not slowing down any funds that are going out to the communities. We also early on adopted, partly by experience, but also knowing how dynamic the situation was, of maintaining a pretty high level of flexibility in the face of changing circumstances. I mean, we would have a policy discussion in the morning on Saturday morning, and by Sunday afternoon we had decided completely different, made a completely different set of policy recommendations, again based on the changing circumstances. I talked a little bit about the infrastructure at the beginning of this presentation, and I'm looking back over the last 5 weeks and seeing all the stuff everything that's been accomplished, and it would not have been possible had the state not invested in the years over in a pretty robust infrastructure. At least I don't think we've been able to do as much as we could have. And similarly, I mean, one of my mantras is that everything happens in the context of relationship. I mean, Illinois has been and continues to be a very highly collaborative state, with a lot of a pretty broad band of usual suspects, if you will, so that we've been able to get stuff done. And one of those usual suspects, honestly, is in the relatively new administration, a year and a half old, is the deputy governor for education. And she's someone that a number of us have worked with closely in different organizations. She understands the system, and has been able to coordinate a lot of these fairly robust supports, both for parents and children, but for providers as well. So I probably talked about as long as I should. And at least I've gone through my slides. So Cami, I don't know if we're going to hold questions for the end after the Louisiana presentation.
Yes, that's correct. We're going
All
to
right.
shoot over to Nasha to lead us in the discussion about about Illinois' response to COVID-19. So Nasha, I'm going to turn it over to you.
Yep, I'm actually going to talk about Louisiana's response. So hi, everyone. My name is Nash Patel. I'm the Deputy Assistant Superintendent of Early Childhood Strategy. I'm excited to join you and talk a little bit about what Louisiana's done, and equally excited to have Jen and Karen on the line share some of the work that they've done as well. I think actually I will defer most of the time to them because they've really been true leaders of this work. So I would say that the Department of Education's response has really been bucketed in 3 ways. First, we found it was critical to get information out to providers and stakeholders as quickly as possible. So we created a birth to 12th grade centralized COVID-19 response inbox, essentially the day schools were closed, and used it to collect all of the queries and make sure that we were sort of seeing trends or issues or concerns as they were bubbling up, and making sure that responses were aligned and we were sort of addressing issues that were sort of hot topics. We inform stakeholders early and often. So we had our first webinar on Saturday when school is closed on a Friday, and then again on a Sunday. And we continue to hold sort of frequent webinars for our stakeholders and our providers. We are now at sort of once a week as information is more trickling, but we continue to try to make sure our stakeholders are informed. And we created a single early childhood FAQ document, which is linked on the next slide, that I think is lengthy, but started out as a really critical resource for folks that made sure to address their most frequent concerns, things like operationally, from how am I going to get paid to what CDC guidance is most important for me to pay attention to, and we've continued to update that daily. The second bucket is flexibility. So we've established a pretty comprehensive plan to seek policy flexibility as needed, again, birth to 12th grade, since we are the Department of Education. And we've worked to make our funding as flexible as possible for centers. And then we've tried to really increase funding for centers. So we expanded CCAP to serve critical infrastructure families. We established contracted care as needed, and we've connected providers with resources and supports as we've been able to find them or as they've been made available. So this slide shows a few of our resources. We made sort of a COVID-19 toolkit, for lack of a better word, on the website. And actually, when you go to louisianabelieves.com, there's a little pop-up that sort of directs you to that website to make it easier to find. And we've published a number of resources, including a food map, which I think is helpful, and some information on academic resources and guidance that we hope that both centers and schools are finding valuable. And at this point, I wanted to see if Karen, if from VOA, if you wanted to sort of add any comments or information here.
Yeah, I'd just like to refer back to something that Dan said also about infrastructure, that I think we were very fortunate that the Department of Ed has worked very hard in the last 5+ years to establish strong infrastructures around the state. And so there's a newsletter that's widely read by childcare providers that let them know about all of these resources. The webinars have had huge attendance so that providers can find out information. There are lead groups in just about every parish, and we R&Rs work with them to make sure that everybody, all childcare providers, are getting this information as LDE, LDH, get more information to share out. And what the R&Rs have been doing is not only making sure that childcare providers are aware of these resources, but following up after webinars to answer questions, to highlight key points. And those kind of constant contacts with the childcare providers, I think, have been very valuable for all parties, because we've been able to hear where confusion lies in child care centers, where there might be some practices that need to be drawn attention to, and we've been able to share that information back with the Department of Ed. So, for example, there was specific guidance given about not combining for meal times, but some people were still combining at nap time early on, and so we were all able to make sure everyone was thinking about the importance of the CDC guidelines in every aspect of childcare. We've also worked really hard that the food map has been very valuable, because sometimes childcare providers themselves have had food insecurity or financial limitations that might make this a struggle for them to obtain food over time. And so we've been able to make sure that they know about that food map, either for the centers themselves or to share with families. We have a very large number of free and reduced lunch children here in the state. And so it's been very important to get that information out to families.
Thanks. Can we move to the next slide? So one thing I did want to mention is that very quickly, I think actually on advice from our CCR&Rs, we reached out to one of our TA partners, Tulane, who provides early childhood mental health consultation to centers, and worked to sort of revamp and expand their contract very quickly. So pretty early on, we were able to make available to any centers that were remaining open, particularly to serve children of critical infrastructure families, that they could receive mental health consultation services. either via the phone or through a telehealth web-based platform. And so they were able to provide information and supports related to child behavior and socio-emotional concerns, helping to support children during the COVID-19 pandemic, self-care for the teachers, stress and coping, director, teacher, and parent concerns, and really other concerns as centers were making them aware of it. And so they have been providing sort of like an open line and free technical assistance to centers as they have needed it and as they have sort of raised concerns themselves.
And another really wonderful thing about this program is that they've also been reaching out and making themselves available to parents. And so it's been a bit slow to help make sure that parents are aware of this, but we're asking child care centers to share it with their families. R&Rs are sharing this information on our social media, and we're reaching out to our parish offices of Homeland Security and emergency preparedness to let them know about the resource as well, because all of us are caring for children in new ways now. Even if your children are not in childcare, now you are your own childcare, your children. And so a lot of additional stress comes with that. And this has been a very valuable resource that is becoming more and more used from what we hear from the mental health consultants.
Thanks so much, Karen. Next slide. So as we thought about care for our critical services personnel, we've really divided this into three sort of buckets. I want to clarify one thing that I probably should have said at the top. So Louisiana did not close child care centers. This was sort of a center decision on whether or not to close, and the majority of child care centers have closed. But Louisiana did provide guidance on, if you can stay at home, you should. The governor did provide guidance on how centers should, follow CDC and Louisiana Department of Health guidance and, limit group sizes and all of those other sort of restrictions. And that really centers should be focused on serving emergency and critical services personnel. So the first big bucket of this is emergency CCAP expansion. So effective March 23rd, families of essential critical infrastructure workers working in response to the COVID-19 outbreak became eligible for the Child Care Assistance Program. And we prioritized families who couldn't afford care. We made the application a pretty simple process, and we're aiming to sort of process these applications within 24 to 48 hours to certify families so that they can go to the centers that are open and get care while they are working in response to COVID-19. We also simplified the process for family home and in-home providers, and we're expediting the approval of those providers so that they can provide care of children of essential workers through CCAP in their home in the event that is the choice that a family would prefer. And then we've also stood up CCR&R contracts for respite care. So through partnerships with child care resource and referral agencies, in particular the two that are on this webinar today, we've worked to establish hospital child care center partnerships in cases where large numbers of hospital staff require child care, or where sort of centers elected to close down and there is a greater need to support those centers that are choosing to remain open, to stay open to provide that essential or critical support. Next slide. In addition, the department is paying for all authorized children the full weekly amount, regardless of the number of days or hours they attended. So we're paying on enrollment instead of attendance. We waived the CCAP co-payments for families. We extended family redeterminations for 3 months, and we extended the reporting deadlines for eligibility determination. We have made it as clear as we can that a child who attends a center through child care assistance, if they are unable to attend a center, this will not adversely impact their eligibility, and that they will continue to be eligible through their redetermination period. Next slide. And then as centers are closing, we want to make sure that families have the most up-to-date information. So we have a parish level map on our website for families to be able to find a child care provider, and this website gets updated in real time. So either as centers notify us or as our CCR&Rs notify us that a center is closed, or reopened. Either way, we are making that information available. And we've created a flyer to also help centers provide that to critical businesses so that they can give it to their staff to help them find childcare. Next slide. One of the most important things that I think we're doing is that we are providing 2 grants to providers who are certified for childcare assistance. One is the Emergency Childcare Relief Grant, which is available to all certified providers, including family childcare and in-home providers, and it's based on their licensed capacity. So it's not based on the number of subsidy children they serve, but based on the licensed capacity of the center. And then the second grant is specifically for centers that remain open to care for children of emergency response personnel to offset the higher cost of operating during the pandemic. And this will be $62.50 per child in licensed capacity. So I will now turn it over to Jen Roberts to talk a little bit about the work that Agenda for Children has done in Orleans Parish and sort of throughout the southeast region of the state, which is one of the hardest hit areas of the state and also of the country.
Thanks, Nasha. So one of the things that I did want to talk about, if we go to the next slide, that'd be great. Thank you. One of the things that I wanted to talk about is, as Nasha alluded, and as if you're watching the news, many of you know that Orleans and Jefferson Parish are 2 of the most significantly impacted hotspots, not just in our region, but certainly in the country and in the world. And some of that was due to a surge of cases that occurred post Mardi Gras. And Mardi Gras, just for the record, did take place before the first case was identified nationally. So sometimes our national media don't quite get that timeline correct. But one of the things is that Orleans did take a very aggressive approach and closed essentially the city in advance of the governor's official notice. So it was very common for folks to close. And what it does mean is that right now we only have around 18% of centers who are open, and we actually know that it's much less now. One of the things that was on our mind as a CCR&R was, given the scale that it was occurring in our community and knowing that, quite honestly, we had community spread before we quite knew what community spread was, is that some families, regardless of whether or not they were an essential worker or not, were preferring to care and have children cared for in their homes. So we worked with some partners at the national level, particularly through the Alliance for Early Success listserv, and we actually kind of pitched this idea to explore whether or not we could partner with an organization like Care.com to provide one-on-one care or one caregiver per each family for families who might not be interested in putting their children into a formal child care center. And what we found was that Rhode Island was able to execute on it, Massachusetts was able to execute on it, Texas was able to execute on it, and Louisiana was not farther behind. And so we were really grateful to Care.com to offer a premium 90-day membership at no cost to any Louisiana home-based childcare provider and or an essential worker who is seeking childcare. So in some cases, because of the intensity of community spread here in Orleans and Jefferson parishes, a lot of our hospitals are giving per diem child care stipends to their employees, and it's on them to figure out what to do with their children during the day. And so this was an opportunity for us to kind of step in and try to broker. In this case, Care.com, allows folks who are interested in finding care to register, those who are interested in providing care, and it also allows them to include if they want to just volunteer. And then they go through a pretty significant background check. Families still have to pay for the out-of-pocket expenses. These are private transactions between caregivers and families. But given the need that we had in this particular region, it was nice to be able to offer an additional option if families were not interested or did not have an other option to be able to take advantage of. This has also proven to be pretty important, given that a lot of childcare centers who were open have then since become exposed in some way to COVID and therefore have had to shut down or perhaps are anxious about, potential exposure. And so while they were really willing to stay open initially, they're no longer able to do so. And so this is about just building variety of options for folks as necessary. Next slide, please. Thank you. In addition to that, in partnership with the Louisiana Policy Institute for Children, which is a statewide advocacy and policy organization located here in our state, we developed a survey for childcare centers that was distributed less than a week after the schools closed. And what it did was it was kind of filtered and partnered with other R&Rs throughout the state, including Agenda and BOA, who is also on the line. And what it did was it assessed, are you closing? If you're not closing, what supplies do you need? And because we were able to get a pretty significant response rate, we were also able to get a one-pager out, not just for kind of regional or parish profiles, but also get statewide data. And since then, we have actually issued a second round of surveys, and then we'll also go through a third round. So it'll actually be longitudinal in the event that folks will be able to assess the impact of COVID-19 on childcare centers. This was also one of the very first ways that we noticed before we were able to build the infrastructure at the state on how many people anticipated they would not be able to come back. And we felt that that was not just information that was important to pursue in that moment, but especially over time. I would encourage you to go to the Louisiana Policy Institute for Children's website or to Agenda's website or VOA's website, where I know we've been linking the results. And as these results come out over time, we'll continue to publicize it there. In addition, there's been 4 things that we've been really thinking about. And as we're thinking about these things, we know that this is where, we did have a hurricane here almost 15 years ago that is really instrumental to our ability to think about how do we rebuild a community and how do we rebuild a sector. And so we have been enormously grateful to the department for moving very quickly and to establishing the grants and the incentives. But the realities here, particularly in the southeast quadrant of the state, means that we have significant losses, we have significant poverty, we have significant public health trauma, and we continue to think about what does this mean, not just for our workforce of today, but our workforce of tomorrow. So what that means is our first priority as an organization and as an R&R has really been thinking about the protections of our workforce of today and tomorrow. What that means is for folks who are currently providing childcare, we are thinking hard and very much advocating for additional retention pay, incentives for them to be able to be there. Supplies, PPE is really hard to get even in our hospitals. And so when it comes to childcare centers, we have not yet been able to tap into really getting the appropriate support and supplies for our childcare centers to be able to feel safe while they're operating. And one other thing that we've been thinking a lot is really around the model that New Mexico took, which is, we have a lot of employees who are working right now in childcare centers, and those childcare centers do not provide health insurance, and their potential exposure is very high. And so we really applaud the efforts of a state like New Mexico, who was able to take advantage of, public subsidy and to provide health insurance for first responders and classified their childcare workers as first responders in that event. We're also thinking about protecting the workforce of tomorrow. And that really comes down to a couple of things. The first is around wages. As many of you know, and I don't know if this is the same in some of our other communities across the country, the Bureau of Labor Statistics here shows that our average, our average weekly payroll for an employee is around $511. So that's what they receive, but that also includes administrators in childcare, which means that number is significantly lower. And so many of our childcare providers have been furloughed and are in fact receiving unemployment. And for some of our staff, we know that that represents as much as a 66% raise in their income. And so for us, we're thinking about tomorrow, who really are going to be the caregivers, and what our incentives are we providing to ensure that folks have not just the opportunity, but the real material benefits of being able to return to the workforce when this is over. I think this also means that one of the things we're thinking about is that centers are particularly vulnerable, especially those that are relying on tuition dollars, because so much of our work has been around really thinking about centers that accept public funding. And as a result of that, that means that our workforce might actually decrease, and the number of available seats we might have relative to the need might actually decrease at a time where folks might actually need it a lot more, particularly if they're thinking about trying to gain or find additional work, which is very hard to do when you have a child at home. So we're thinking certainly about that. One other thing that we're also thinking about is how do we support the business viability of our sector. So we have some childcare centers who have been ineligible for applying for the payroll protection programs or the SBA loans or grants. It's for a variety of reasons. Sometimes they're sole proprietors, sometimes they don't have good financial bookkeeping, things like that. And so, you know, as we are thinking about how to kind of boost up the business viability of the sector in a general sense, we know that we're going to lose centers who are going to need even additional support getting back on their feet. And that might mean technical assistance as we've provided in the past, but it also might mean general operating unrestricted grants to be able to re-recruit their staff to come back and to help get folks back on the ground, back up. The second to last thing that we've been really thinking about is what is the role for federal engagement? So, you know, speaking as someone who you know, went through Katrina here, you know, we've got experience here that tells us that, you know, when Katrina happened, we were the beneficiaries of the generosity of, you know, millions of people across the world. And what our experience is telling us now is that, you know, this is happening across the world. And what that means is that it's really going to be on local folks to be able to have to rebuild their sector. And it's going to have to also be in partnership with the federal government. And so we think about how are we advocating and changing policies, particularly at the federal level, that we know are going to have a potentially inequitable effect on the local ground. So for example, childcare assistance is a great example of that. It requires and typically has a work requirement. Well, if most of your population no longer has work due to this pandemic, can we start to manipulate and change and alter some of the requirements around that so that if you're actively seeking work, it's not just a temporary order, but potentially a permanent order, given the potential economic impact of this. The other thing that we would also argue is that we really would think that the federal government should really think about the mental health. And so kind of extending what Nasha talked about with our mental health consultation with Tulane, you know, we know that financial insecurity and worry about jobs and isolation and the potential inability to meet children's basic needs has created an enormous amount of stress for parents and for caregivers. And so if families don't get both the material support and we would argue the mental health support, we're going to see this stress transform into toxic stress, which is going to have long-term negative effects on children's brain development. And so teachers are going to have this toxic stress, parents are going to have this toxic stress, and young children, you know, and babies really lack the knowledge and the language to express their stress and worries. And so what we anticipate and know that we need to think about is how do we have a national perspective around the public health pandemic as well as the actual physical health. And then lastly, I know I've mentioned, you know, natural disasters, but that is also something that is very much on our mind right now. New Orleans and Louisiana in general has experienced several hurricanes and several floods over the last couple of years, and we know that we are not alone. This is not just a coastal issue. And so as we are thinking about responses to COVID, I know that our community in particular has been talking to our colleagues in Atlanta and Houston and Mississippi and Florida, who particularly are about to enter hurricane season and trying to kind of grapple the realities of what will happen if we have to simultaneously address a COVID-19 pandemic response at the same time as thinking about evacuations or migration or you know, physical spaces being destroyed. So I know that we're not alone in that, and I'm going to kick it over to my colleagues at Karen to talk a little bit about their response as well.
Thanks, Jen. So I know we're getting close to time here. I just want to touch on a few additional practices that have been put into place in Louisiana and a few additional observations from the resource and referral agencies in Louisiana. As County mentioned earlier in the call, at Volunteers of America, we serve 24 parishes across the greater Baton Rouge, southwestern Louisiana, and central Louisiana areas. And so it's very interesting to see where the needs are the same across these urban and rural areas and where they differ. some of what we have noticed is that that real-time map that Nasha mentioned is very important, because we have centers closing and reopening sometimes within a week or 2 weeks in the same center. And the reason that's happening is because, sort of as Jen alluded, people are having COVID scares. Someone's coming down with some potential symptoms and they close down while they wait the results of tests. They close down to do deep sanitation from time to time. And more employees, unfortunately, are finding that there's a higher financial incentive for them not to show up for work. We're also seeing that there are some challenges in rural communities. We are certainly working closely with hospitals. We've developed many new relationships with the hospital partners in our parishes, and we are referring critical essential personnel to open childcare centers where we can, but in rural areas, for example, that's challenging because there wasn't a great deal of childcare available there in the first place, and now much of what there is closed. So we have set up some hospital partnerships in several of our parishes. We're providing care in one case on site in the hospital building, in an administration building. And in another case, we've partnered with a closed child care center that is near a hospital. And that child care center has not wanted to provide the care themselves. They have been happy to enter into a cooperative agreement with us where we're actually renting their center and their resources. We have very clear agreements with the hospitals that they provide cleaning, disinfecting materials, gloves, food for the children and the workers. And we are hiring teachers from high-performing centers that come from centers that are currently closed to provide the care. So we are still trying to support the industry as much as possible despite those challenges. As Jen mentioned, donations, R&Rs are distributing donations because it's hard to access materials. The state implemented an authorization letter at a childcare provider's suggestion that would allow childcare businesses to purchase more than the amount of items that individual families are being limited to in many stores. And so that was a great innovation, but it's still very hard for many providers to access the materials they need. So we're looking for donations. Volunteers of America is a national organization. We're looking to see whether we have national partnerships that we could utilize to obtain more materials for centers. And the state is also looking at our state purchasing program to see, what strategies are there for linking up childcare providers with the materials they need. We also have a special set of circumstances here in Louisiana called the School Readiness Tax Credits. And there's a set of 5 tax credits, one of which directly goes to childcare resource and referral agencies. And so we're looking at using some of those privately raised business dollars to purchase needed materials to, again, try to address some of the financial burden centers are facing during this time. Centers are very concerned about operating at the new ratios by the CDC. Many centers do not have access to lines of credit. Many centers report difficulty being able to apply for any of the SBA loans through banks because they're not all effectively banked. So we're definitely seeing a number of challenges throughout our regions. We have some rural parishes that I think show us the potential fallout from a disaster like this. One of them, Livingston Parish, had 12 childcare centers that accepted public funds in 2016 before some very severe flooding hit this area. And now they're down to 4 pre-COVID. So it's concerning to know whether all 4 of those will be able to reopen after COVID. So relating back to what Jen mentioned, we know that there are a lot of challenges still that we're facing and that we'll need to implement policies for.
Wonderful, thank you. Kiyomi, do we have just a couple of minutes now. How would you like to turn to questions?
We have just a couple of questions, Ami. So one of them is for Dan. And Dan mentioned earlier that there was a webinar on business practices that was done in Illinois, and they were wanting to know how can they get access to that webinar.
Right, and I think that link is provided both in the chat box here and also is included in the webinar in the slides as a part of this webinar. Or if someone wanted to Google search ILGOECD COVID, they'd find that website.
Thanks, Dan.
Mm-hmm.
Just a comment that they loved how you addressed the reality of natural disasters and that they're going to happen regardless of what is happening with COVID. We need to continue to prepare for these types of emergencies as well. And that's all of the questions that I'm seeing.
Excellent. Well, we are at time, so I want to thank our experts and our presenters from Illinois and Louisiana very, very much, and want to thank all of you for attending. You will be seeing on the slide right now some information about CCAOA's virtual symposium. So we had planned, like many groups, to have an in-person, but we have switched to a virtual symposium taking place on Monday, May 4th. And we would love to have you join us. There's a few slots left if you sign up sooner rather than later to learn how to take some of what's happened here and advocate with your members of Congress and your local and state policymakers to make sure that the lessons that we're all learning from COVID-19 end up effectuating more permanent change. So go to childcareaware.org to sign up for the virtual symposium, and thank you for joining us today.